Hey, this is Shannon Holton, Real Salty Dietitian and owner of Sound Growth Nutrition and Wellness. For today's My Truth Tuesday, I wanted to talk a little bit about my passion. Now, you might think that my passion is nutrition, and it is, but my true passion is the overall broad spectrum of healthcare. In 2017, I did get my master's degree in public health. I didn't get a master's in nutrition because I really do like learning about and understanding the bigger picture of healthcare. And that's a whole argument in of itself. Everybody has their opinions, thoughts, and feelings on our healthcare system, whether it's from the cost of prescriptions to the requirements needed and the hoops to jump through to access different kinds of care. And I have my own thoughts on that, especially as a dietitian who mostly requires referrals in order to see patients. So the first thing I want to say is that in private practice, it has been a little bit more limiting in terms of my access to figuring out how to help people who are in a need situation. The first thing they have to have one is insurance to have nutrition coverage. But then the other side of that is I have to have insurance contracts in order to provide that service to be paid for the nutrition service. And what I will say is that the insurance game has been a little challenging. I've talked about that before, but here we are sitting about 6 months in from my initial attempts at applying, and I'm still jumping through some hoops in order to get insurance coverage. I'm still waiting for that process to be accomplished. But in the bigger picture of things, what I wanted to talk about was the social determinants of health and how that can impact nutrition and how I choose to approach families and clients and patients as it relates to nutrition care. When you think about social determinants of health, those who don't know what they are, those are things that are outside of direct medical care that can impact the health of people. So, for example, housing, transportation. We talked about food insecurity quite a bit and how that can impact it. Now, as a dietitian, we get lumped into the food insecurity box in terms of how we help people. But I've often found that a lot of programs that are out there focus on the food, tangible food. So food boxes are given. There may be some group classes that are done to provide, some research-based education on how to shop and things like I provided before. But that one-to-one impact is important because everybody has a different hierarchy of their social determinants as it relates to where they're at in their life. So not everybody who is food insecure has housing issues. Not everybody who is food insecure has transportation issues. And so if you're doing a group class, it may not hit all the points that are important for a patient or a client or a family in order to overcome that hurdle to be able to implement some of the nutrition recommendations. The first thing I do is look at the bigger picture of their social determinants. For example, if somebody has housing issues, if they don't have a stable home or a stable place that they sleep every night that is covered and paid for, if they have issues with electricity being turned off because of bills, there is a higher risk, and we can't expect that they're going to go out and buy a week's worth of groceries with the recommendations I gave last week because they may not have a space big enough to hold those groceries. Or if they don't have reliable transportation, they may not be able to get to a grocery store that would sell things at a better cost than a convenience store that they could walk to. So when you're doing a nutrition assessment, you really need that one-to-one aspect, especially if you're looking at the socially at-risk families, because they don't all have the same issues. And so that is one of the things that I've been kind of on a kick of lately, and figuring out how it is that I can start to kind of develop an idea and a program and something that can address these needs individually so that you can make a bigger impact and not keep coming back to those same issues that they have over and over again. Now, I, as a dietitian, am not going to be able to fix somebody's housing issues or their transportation issues. But what I can do in the meantime, while perhaps other people are working on those things to help them, is to provide recommendations that would meet the needs of where they're at the moment, and give them that confidence to know that they have options to provide their nutrition needs and not be overwhelmed sitting in a group setting class being told what to do and how to do it and realizing that I can't do any of this, and feeling more helpless or more hopeless. That is probably the biggest beef I have right now, I think, in our healthcare system as it relates to a lot of these newfound programs that are out there to help with addressing social determinants of health and making a healthier population. I think they hit the mark in a lot of areas. There's a lot of really good starting and a lot of rumblings of programs, but we really need a bigger push to be able to address the bigger picture. I'm a forest kind of gal. I'm not a trees kind of gal. So when I think of anything related to healthcare, I do tend to think about where it goes back to. I start with the direct referral and I kind of work backwards when it comes to those social determinants. I am really trying to work on figuring out how a private practice where I am kind of dependent on those cash transactions, that I can start to help to make a difference in those social determinants and helping people that have the need to make some changes in their nutrition and their diet around the barriers and the actual struggles that they live with every day. Hopefully by the end of the week, I'll hear something about one of those insurance companies that I can then start to see some of these referrals coming in. And I hope that everybody has a great week.